One of the most conservative options to treat disc-related pain due to disc bulging and/or degeneration is epidural steroid injections. The epidural space is the medical term for the space surrounding the spinal cord. Placing anti-inflammatory steroids into the epidural space helps reduce inflammation and reduces the size of a bulging disc. This in turn reduces pressure on the nerve root, which reduces the pain, weakness, and numbness often associated with disc-related problems. Epidural steroid injections using the traditional translaminar or midline approach is frequently used when patients present with symptoms of pain radiating from their back into both lower extremities and have not had prior back surgery. Surgery often leads to scar tissue formation, which in turn can prevent the spread of the steroid solution onto the irritated nerve or nerves. This approach does not require fluoroscopic guidance and is also the approach typically used for laboring women to reduce the pain of childbirth. Translaminar epidural steroid injections are typically performed with the patient in a sitting position, leaning forward to open the space between the bones of the lower spine, making it easier for epidural placement. After identification of the appropriate area, Novocaine is used to numb the skin and deeper tissue in preparation for epidural needle placement. The Novocaine typically causes a burning discomfort similar to that experienced during dental procedure. An epidural needle is then placed into the appropriate position, at which time pressure is often the most noticeable sensation. Once the epidural needle is in place, a steroid solution is injected and the needle removed from the patient's back. At the end of the procedure, the patient is asked to lie down and is observed for 10 minutes to allow gravity to hold the medication in place.